Good afternoon, everyone. It is 1 o'clock, so we'll go ahead and get started. Thank you all for joining us for 2022 statewide training. This is going to be specific to prior authorizations. My name is Stephanie Packer. I am the PA manager over prior authorizations. I also have additional leadership through our PA team, as well as managed care and policy. So as we go throughout this presentation, if you have any questions, please make sure to ask as we kind of go. You can drop them in the chat and any of the team members can go ahead and answer those for you. You can also raise your hand and we'll try to address those as we go. Just due to the large size of the meeting, just make sure that you do mute yourselves unless you're actively asking a question. We'll go from there. So first over, we will be going over our state agency consolidation. We'll review a little bit of managed care, explain kind of what the OHPA team is or who that involves, how to submit a prior authorization, specific requirements behind those authorizations, and the criteria resources that you can access. We'll also go over a little bit of what's new to prior authorization, and then discuss just a little bit about Prism, which I'm sure you've all heard about. So on July 1st of 2022, the Utah Department of Health and Human Services was created. This all started due to general legislative session in 2021. They passed the HB 365 state agency realignment. And so we're just excited to be part of this change and compilation. DHHS is designated by CMS as a single state agency to basically administer and supervise the state's Medicaid program. Responsible for implementing, organizing, and maintaining the Medicaid and CHIP programs. Most specifically about managed care. Managed care is a system that was designed to manage cost, utilization, and quality of care that we provide. Medicaid and CHIP delivers health benefits through contracts of managed care entities. So these can include ACOs, UMICs, home or behavioral health programs, dental, PMHP or prepaid mental health plans. And then the CHIP also covers MCO and an additional dental plan. So these are all programs in which the provider would need to contract specifically with the ACO. We work in unison with them, but we do not process their requests or so forth. This additional slide just goes over a chart. It may be hard to see all of the contact information, so definitely utilize the PowerPoint that was sent out to you for these resources. But this is just additional contact information for the specific managed care entities. Some of those ACOs can include Health Choice, Healthy You, Molina, Select Health, the Home Program, and then obviously our 2 dental programs as well. Prepaid mental health plans also have additional contact and resources. This is managed through, as you can see, by county or organized by county. They provide additional resources or telephone numbers, contact information for inpatient versus outpatient as well. Again, just due to the size of this resource is going to be best utilized through the PowerPoint that's been sent out. If you have any questions, you can definitely ask those as well. And moving on to our prior authorization team. As you can see, we have changed from, or our title is now Office of Healthcare Policy and Authorization, or OPHA. And so you're going to notice that new acronym coming through on prior authorizations and correspondences through our office as well. That's part of that compilation that we talked about earlier. On the prior authorization team or staff, we have a variety of individuals from registered nurse to licensed clinical social workers, consultants, and then review staff as well. Our main job is to ensure safe, appropriate, and cost-effective use of the services for fee-for-service members. And as you can imagine, we are extremely busy. We do an average of 3,300 PAs per month and receive an average of 1,000 phone calls. So very busy. Kind of diving a little bit deeper in submitting prior authorizations. When you start to submit a prior authorization, or we get to that point, we want to make sure that you are selecting the correct and most recent form for the service that you're requesting. These can be accessed through our Medicaid website. There are 14 forms that'll be listed in alphabetical order. And this will actually be updated starting in December. We will have one general PA form that again can be accessed through our Medicaid website. We do request that you fill in all of the required fields or all of the fields that are present on your specific form, and then fax it to the appropriate inbox. And that will be listed on the PA form. You do want to make sure that you're including specific contact information, so an individual's name rather than the company or provider. That way, when we do reach out or have questions or returns, someone can be contacted. Once your request has been submitted, or your specific form, it will be received and reviewed. There's multiple things that can happen from there. It can be approved, returned, or denied. In all of these situations, you will actually receive a letter with the details of further information. In the case of a returned prior authorization, you may just be missing a little bit of clinical information, or maybe you missed an NPI or a certain field on the form. Or if it was in the case of a denial, you'll be receiving a letter that has further information on a request for hearing or why that was denied. So those are also helpful. During that process prior to approved, returned, or denied, your prior authorization may also go into a pending status. This is basically an internal review that can mean we are waiting for a primary review from a nurse, or it's been reviewed and it requires a secondary review with a provider or on a committee. So that can take a little bit more time as well. And this diagram just kind of reviews that further, the medical prior authorization process and the steps that can be taken. Ultimately, there are only the three outcomes: approved, denied, or returned, as we process those. Some additional tips when submitting prior authorizations with Medicaid are verifying member eligibility and utilizing the coverage and reimbursement lookup tools. Both of these are going to be utilized on your prior authorization forms. And so utilizing both of these links to verify whether the patient has an active Medicaid plan, and also if the code or the service that you are requesting requires authorization, are both beneficial to kind of determine what information you're going to need, making sure that the correct documentation aligns with the code that you're requesting, and that no further forms or consents are required. And as a prior authorization team, we do strive for a 7-day turnaround. That does fluctuate kind of depending on teams and requests received, but that is the ultimate goal. And both of these links can be accessed through our Medicaid website as well. Some of the additional resources that help when we're determining prior authorization and criteria. On our Medicaid website, there's a few different areas in which your criteria can be found. You can utilize the provider manuals, the MIBs or Medicaid information bulletins, and the lookup tool. This allows you to find specific criteria or contact information for the PA team and policy team if for some reason you weren't able to locate your specific criteria or procedure codes through some of these tools. Another tool that we talked about last year is InterQual. This is a really fantastic tool and resource that I would encourage you all to use. This is the same web-based criteria that our PA team utilizes. However, this specific tool will allow you to see a view-only version of the required criteria for your request. If you simply click on the link, it will allow you to register, and it will take you to a login page similar to this. You will need to be a Medicaid approved provider in order to enroll in this. And then from here, again, you can see a view only version. There's nothing that's required. You can save your sources. You don't have to submit that criteria with your request. You can simply just continue to see those. We do have a few changes that have occurred in PA or prior authorizations. One of those is the required use of the coverage and reimbursement lookup tool for your PA requirements. We do encourage, and again, as stated before, those prior authorization forms do have a spot that indicate, is this required for authorization? So we do want you to utilize that tool. Again, we don't want you submitting requests that you don't have to. We have also updated InterQual criteria, that lookup tool that we had previously discussed, as well as our provider manuals. The big change that we've made or updated is the retro authorizations have changed to 180 days for the specific following services. And then we've also included specifically 4 new services that include inaccurate information, exceptions for inmates of public institutions, members with Medicaid and Medicare, and exceeding quantity limits. And I'll talk about those specific for today. And these next few slides are all going to be pulled directly from the general provider manual. So if you do want to go back and reference those or these, they are available to you. This requires, let's see. I lost where I was. What was I talking about? So inaccurate information, I apologize. This includes cases that Medicaid may have provided inaccurate information to you or your team in regards to requiring a prior authorization. So if that was the case and we provided you with inaccurate information and a prior authorization was not obtained, you can submit for retro authorization on that. You will be required to submit supporting documentation, whether that's screenshots or timestamps or whatever of that communication as well, if you so choose to file that. The next change goes over to inmate claims. Due to a previous policy that was in place, claims lacking a prior authorization were actually paid out. Following an investigation to this, a new policy was made and retroactive prior authorizations for inmate claims was created. Procedures that require prior authorization are now eligible for retroactive authorization, and we have actually increased that from 90 to 180 days, again, aligning with the general change. This also just goes into further detail in regards to the lookup or eligibility tool. The eligibility tool can indicate that inmates are eligible for Medicaid prior to incarceration, although inmates are not eligible for Medicaid while incarcerated. So you may render medically necessary procedures that require prior authorization prior to obtaining that prior authorization, and then submitting a retro on those as well. In the case of dual eligibility, retroactive authorization for DME, medical supplies, prosthetics, and orthotics will be considered, except in the case of supplemental plans. So this is only in regards to Part A and Part B Medicare when they are dual enrolled. And then the next major change, or the last one that I'm going to talk about, is quantity limits. We have updated this in regards to quantity limits count specifically towards the member rather than the provider requesting. So this change will allow for retroactive authorizations when a provider inadvertently exceeds that limit, potentially because the patient changed providers or that service was previously provided by another provider. The exception to this is that it would not apply to pharmacy claims. The last major change in prior authorization would be our Prism. We do plan to go live with that in January of 2023. There will be some updates to processing during this period. However, you're going to receive further detailed information over the coming weeks in detail of what those look like and what will be required. Additionally, we do have adjustments pertaining to the public health emergency that will incur at the expiration of the PHE. Again, we'll release further communication and information as that becomes closer in time. Diving in specifically about Prism, Medicaid will be replacing our current data system, which is MMIS, with a data system called Prism. We're super excited to implement the system and think it will really improve our PA processing and overall for providers and internal use. So just make sure to stay up to date with any Prism changes. You can do that through the MIB articles. You can participate in e-learnings that are available. Those will be posted as they're released, as well as we will have provider training courses that you can register for. There was also a statewide provider training on Prism that occurred last week. The slides should be available online for you to review shortly, or the recording if needed. And then obviously, if you have any additional questions as you're going through this prior authorization process, please reach out to the departments. You can access us through customer service, through the telephone numbers that are selected, or also the email that's listed. We would love to help you through these processes. The PA team is fantastic, and often you guys are very familiar with them already. So we'll open it up to any questions that you guys were unable to ask in the chat at this time. Doris, this recording will be posted on the Medicaid website as well. Yes, Misha, the recording will be available. So I do not have the direct link to that. Sharon, is that something that you can post? Oh, perfect.
And Misha, I can answer your question for ABA. There's kind of two parts to this question, actually. We are in the process of revising our ABA policy. Our next steps are to get those out to the policy revisions out to some of our stakeholders for review. And then once we get that review back for our ABA policy, we'll be sending out official publication of that manual on the policy revisions. As far as additional changes that may be going into Prism, those changes are largely, the biggest change there is that providers will no longer have to actually fill out like a paper PA form. They'll be able to log directly into a provider portal and enter in their requests directly into the provider portal. So it'll be a little bit easier for you to see the status of requests. That change doesn't specifically only affect ABA requests, but it would be all of our requests across the board. You're welcome. And that link that's not working, is that the one, Sharon, that you just posted, or what link was that? Okay, I'll answer that Prism question too. Training for Prism. As of right now, our tentative plan is to start training providers on Prism in November and December. This is a very preliminary plan, but we're hoping to offer a lot of different training options that providers can sign up for. Ideally, these training options will be kind of by provider type. So we'll reach out to, or we'll ask people the autism providers to sign up for an ABA specific training. We'll ask our home health providers to sign up for a home health training, just so that we can target those different provider types a little bit more specifically. Right now, we are planning on doing that all through November and December with essentially weekly training. So there'll be, options for you to attend one, there'll be options for you to attend it multiple times if you want, but we really want to try to make sure that everybody is as trained as possible when we're entering our go live date. Do we know which link it is, Danielle? That one. Okay.
So Stacy, I'm trying to, Sharon just answered it, but I actually just clicked on that link and I have no problem getting into it. I was just going to ask what link she was trying, but if you just go to the regular Medicaid website, and then there's 3 different areas: members, healthcare providers, managed care, and Prism. If you click on Prism, I was able to click on it and it just came right up. So, on the slides. Yeah, you'd probably be better off just going straight to the website.
I do want to go back and answer Samantha's question. When checking the Medicaid eligibility lookup tool, what are we looking for that tells us if we need a prior authorization or not? So it's actually 2 different resources. What you're going to want to utilize for specifically prior authorization is the coverage and reimbursement lookup tool. That tool allows you to basically add your provider type in the CPT code that you're looking for, the date of service, and just push enter. From there, you'll be able to see specifically traditional and non-traditional coverages for those.
I was going to add, the eligibility lookup tool will tell you if they have a managed care plan, so you'll know who to seek PA from if you need to.
Thank you for that clarification, Dave.
And I can take Samantha's question. Prior auth. So for things that are considered carve-out services, so ABA therapy is a really good example of a carve-out service because That's a service, I'm going to define carve-out service, that even if the member has like a health plan, that service won't be covered by the health plan and will come directly to fee-for-service. So ABA therapy is an example of that. That's a fairly big program. The health plans aren't contracted to cover the ABA therapy, so those requests come directly to fee-for-service. That's really the difference there, is that if you do provide a type of service that doesn't go to the health plan, you would just need to submit it for fee-for-service. But as far as like our internal process regarding how we would handle a prior authorization, we wouldn't handle that any differently than we would if we were looking at one that is either a fee-for-service member or a service that's not carved out. Does that answer the question, Samantha? Okay. Nice. So Ariana, with the provider portal with Prism. You know, I don't know if we have anyone there. I don't think that I don't really have a great answer to this question. This would be, right now, all of our providers are using Prism for their like provider enrollment access. And as long as you have that access, I don't think there should be like a time period that you won't be able to log in or have approval when it goes live. I think if your agency has Prism access, you should continue to have Prism access. But I'm going to take that question back just in case there's any specifics to that I'm not aware of. Because I don't think there's anyone from provider enrollment here. Okay.
Just want to make sure there's no additional questions that we missed or from anyone else. Okay.
So it looks like we had one more question from Maria. And Maria, when you ask the ABA PA is staying the same, do you mean like the process for requesting ABA, the policy for ABA, or it being a carve-out service? I can answer all three of these. Okay, the process. So the process when Prism goes live, so today the process for requesting ABA is the same, but when Prism goes live, it is highly encouraged that providers will use the provider portal to request ABA services rather than filling out our current prior authorization request form. All of our prior authorization request forms will change with Prism regardless, because there's a lot of fields that are required in Prism that are not required in our current legacy system. It will be much easier. It should be much easier for providers to log directly into the provider portal and just enter those requests in directly into the system. That's the biggest part of the process that will change as far as the system change. But there are some things in our policy that we're looking at changing, and hopefully we'll get that draft manual out in the next couple of weeks to our first round of stakeholders, and then get it published. Our goal is to publish it by November. So some of those policy changes might kind of change some of the process, I guess, as far as what type of information you need to submit to us.
Thank you, Stacy.
Mm-hmm.
I can see a new question on there from Maria about Prism. Did somebody answer that already? Did I miss it? Just if it's encouraged that they use Prism?
Yeah, I don't think it has been answered. There's
Okay.
no requirement for providers to use Prism, but it would be, there is a lot of benefits for the provider to use Prism. You'll have a lot more real-time information when you're logging your requests in directly to Prism. There would be just much more of a delay. You're adding a couple more steps if the provider decides to stay with the paper form. Yep, you're welcome. And Karen, are you pharmacy or with a question about the formulary list? Okay. Can you give me some clarification about what you mean for formulary list? Okay. So I think that question would be better answered by our pharmacy team. We have what's called a preferred drug list on our pharmacy website, but the request forms for what you would use for a preferred drug or a non-preferred drug are different. And I can give you the link to where that preferred drug list is, as well as the pharmacy. But if you have a more specific questions about the pharmacy, Sharon, what is the pharmacy one?
So Dave just put it in the chat. So the training for pharmacy is tomorrow at 1 o'clock.
Yeah, okay. And I can still put the link to the pharmacy page. I'm also going to just link the pharmacy page in the chat. That's where you would find all of the pharmacy criteria forms as well as that preferred drug list link.
Fantastic. Are there any last minute questions? If you're not able to put them in the chat, you're also able to just turn off your mic and ask them if you need. Alrighty, well, thank you all for joining our training today. Hopefully this makes submitting prior authorizations or some of the changes that have occurred a little bit more clear. Like stated above or within the chat, there is a link to the recording if for some reason you had to join late or missed the majority of this training, but please feel free to reach out to our email or the phone number that's listed if you need any additional assistance or questions. Thank you all and have a great rest of the day.